Assalamu alaikum and welcome to our presentation. Today we are going to discuss a mosquito-borne viral disease that poses a significant public health challenge, especially during the rainy seasons. However, with proper knowledge, preventive measures, and early medical attention, its impact can be greatly reduced. Today's presentation aims to increase awareness about the causes, symptoms, prevention, and management of this disease. We are talking about the dengue fever. Dengue virus belongs to genus Flavivirus and has four distinct serotypes. Dengue is transmitted primarily from human to human by the bite of Aedes mosquito. Healthcare associated transmission, needle stick or mucocutaneous exposure, and vertical transmission occur rarely. An estimated 100 to 400 million cases of dengue fever occur annually. Along the malaria, dengue is one of the two most common vector-borne diseases of humans. Dengue is also the second overall cause of febrile illness after the malaria. The incubation period is usually 7 to 10 days. Most infected patients are asymptomatic. Only 20% develop symptoms ranging from mild disease to severe hemorrhagic fever to fatal shock. After the incubation period, the febrile phase can begin abruptly with non-specific symptoms, high fever, chills, facial flushing, malaise, retroorbital eye pain, generalized body pain, and arthralgia. Some patients might have mucopapular rash, sore throat, and conjunctival injection. Most of the patients will recover, and fever is usually cleared by the day 8. Hematocrit increase may be the earliest sign and an indicator of the severity of plasma leakage. Leukopenia is characteristic, and elevated transaminases are found frequently in dengue fever. Thrombocytopenia, fibrinolysis, and hemoconcentration occur more often in the hemorrhagic form of the disease. In other forms of the disease, especially in children, anemia is more common. The ESR is normal in most of the cases. Usual complications include pneumonia, bone marrow failure, hepatitis, iritis, retinal hemorrhages, and maculopathy, orchitis, and ophritis. Neurological complications such as encephalitis, GB syndrome, phrenic neuropathy, subdural hematoma, cerebral vasculitis, and transverse myelitis are less common. Bacterial superfection can occur. Oral complications include acute gingivitis, palatal bleeding, tongue plaques, xerostomia, and rarely osteonecrosis of the jaw. Maternal infection poses a risk of hemorrhage in both the mother and the infant if infection occurs near term. Severe dengue is a risk factor for obstetric complications, cesarean delivery, fetal distress, and maternal morbidity. Non-specific therapeutic options are available for the clinical management of dengue besides supportive care. Treatment entails the appropriate use of volume replacement, blood products, and vasopressors. Acetaminophen is recommended for analgesic and antipyretic treatment. NSAID uses should be minimized and preferably avoided. Platelet transfusions may be considered for severe thrombocytopenia when the platelet count is 10,000 or less. The estimated mortality is 2.5% in severe cases. Causes of death include hemorrhagic fever, also seen in recurrent diseases, and occasionally fulminant hepatitis. Thrombocytopenia and acute hepatitis are predictors of severe dengue and high mortality. Acute kidney injury in dengue shock syndrome portends poor prognosis. Control of mosquitoes by screening and insect repellents, including long-lasting insecticides, particularly during early morning and late afternoon exposures. Screening blood transfusions for dengue is important. There are some vaccines available for dengue virus, which includes dengue vaxia, a recombinant live attenuated vaccine and is tetravalent. The vaccine is given as a 0, 6, and 12-month series, although two doses schedule is likely efficacious. Pregnant ladies and immunosuppressed persons should not be vaccinated. Another vaccine, which is also a live tetravalent dengue vaccine, Takeda's two-dose TAK-003, completed its phase 3 clinical trials with 3 years of follow-up and showed cumulative efficacy of 62% against symptomatic dengue cases and 83.6% efficacy against hospitalized dengue cases. Thank you.